Antenatal betamethasone for women at risk for late preterm delivery. Infants who are born at 34 to 36 weeks of gestation, let's say preterm, are at greater risk for adverse respiratory and other outcomes than those born at 37 weeks of gestation or later. It is not known whether betamethasone administered to women at risk for late preterm delivery decreases the risk of neonatal morbidities. Methods. So what we did was that we conducted a multi-center randomized trial involving women with a single-tone pregnancy at 34 weeks 0 days to 36 weeks 5 days of gestation who were at high risk for delivery during the late preterm period. The participants were assigned to delivery to receive 2 injections of betamethasone or matching placebo for 24 hours apart. The primary outcome was a neonatal composite of treatment in the first 72 hours. The use of continuous positive airway pressure or high flow nasal cannula for at least 2 hours, supplemental oxygen with fraction of inspired oxygen at least 0.30 for at least 4 hours, extracorporeal membrane exudation or mechanical ventilation, or stillbirth or neonatal death within 72 hours after delivery. Here's a video to explain more about it. Results. The primary outcome occurred in 11.6% of the betamethasone group and 14.4% in the placebo group. Severe respiratory complications such as tachypnea of the newborn, surfeit use, or bronchopulmonary dysplasia also occurred significantly and less frequently in the betamethasone group. There was no significant differences in between the incidence of chorioamnitis or neonatal sepsis. Neonatal hypoglycemia was more common in the betamethasone group than in the placebo group.